I just want to thank everyone for being here today, and I'd like to introduce the Premier who's participating in this press conference via teleconference. So Premier, over to you on this.
Thanks very much, Doug. Thanks to everyone who's there. I was hoping to be there in person, but as you probably heard, I'm in isolation until next Thursday. As I think you've all heard, our great Municipal Affairs Minister, Tracy Allard, tested positive for COVID yesterday, and we quickly assessed who in the government had been close contacts of hers in the previous few days, and I was one of those folks at a news conference with her a week ago right now, and I've tested positive, but I'm going to, of course, follow the public health guidelines, which require 14 days of isolation from the date of exposure of a close contact. And that's also being observed by Minister McIver and MLAs Angela Pitt, Peter Guthrie, and Nathan Neudorf. So my best wishes to Tracy and to everybody who is coping with COVID for her and a rapid recovery. So as you know, during this disease has impacted all our lives in so many different ways, but we can't allow it to shut everything down. And just a few months ago, the Calgary Airport would have been brimming with folks as they were leaving to travel around the world or return from countless destinations around the globe. As one of Canada's largest and busiest airports, it's really alarming to see how empty it is today. Travel and tourism are some of the fastest growing industries in Alberta and around the world. But the impact of COVID-19 has caused that to come to a sudden halt. There has been no industry hit harder by the COVID-19 pandemic. In March, a mandatory 14-day quarantine was put in place for all travelers entering Canada from outside the country. This restriction was implemented by the federal government to help prevent the virus from being brought into our province, into our country, and slow its spread across Canada. The impact of the quarantine and other restrictions has been enormous for businesses and communities across the country. Closed borders combined with a mandatory 2-week quarantine period for incoming international travelers have resulted in one of the biggest challenges ever faced by Alberta tourism. In Alberta, visitor spending for 2020 looks like it's going to be about $3.5 billion, which is a 63% drop from last year. And of course, this has impacted countless jobs, from airline pilots and flight attendants and crews and dispatchers, ground personnel, ticket agents, tour operators, and so many more. And behind every one of those jobs, there is a family who's facing uncertainty and a person who needs to pay their mortgage or a parent who needs to put groceries on the table. That's why we cannot turn our back on the travel industry, the tourism industry, and the Albertans whose lives have been thrown into upheaval as a result of the pandemic. COVID-19 is still here, and it is still a serious health concern. But we've come a long way since March. Our testing capacity has expanded massively, and we've been on several days hitting our stretch target of 20,000 a day. We're determined to go to 22,000 a day every day once our private sector partners are able to go to full capacity. Our public health measures have become more targeted as we learn more about this virus, how it spreads, and the best ways to prevent exposure. The spread of the virus in Alberta is also significantly different today than it was in the early spring. At this time, only about 3% of the active cases in Alberta have been acquired through travel. Recognizing this, and the fact that COVID is not going away anytime soon, we've been looking at new ways to support the travel industry and support safe travel. We must find ways to bring back safe travel if we're ever going to get the economy firing again on all cylinders. And one of the key challenges for incoming travelers is the 14-day quarantine, meaning travelers need to take at least 3 weeks off for a single 1-week trip. This is why I am happy to announce that Alberta's government is joining the Government of Canada and our industry partners in launching an exciting new pilot program that is the first of its kind in Canada. This pilot program will safely explore whether a new approach for managing the international borders is possible, one that uses testing and other public health measures to reduce the quarantine period from 14 days to just a few. We're leveraging the close cooperation among our provincial and federal governments, as well as industry partners and Alberta's dynamic COVID-19 testing experience. Starting in early November, returning travelers entering Alberta from outside the country will be offered a chance to participate. They'll receive a COVID-19 test if they choose to. This is voluntary, upon entry into Canada before proceeding into quarantine. Once their test comes back negative, they'll be allowed to leave quarantine, provided they get another test between days 6 and 7. And the reason for that is the same reason I'm under isolation right now, which is that the virus can take some time to develop and become detectable. Health and safety, of course, remain our top priority. Every participating traveler in this program will be closely monitored. They'll have to provide daily check-ins and follow other preventative health measures, such as wearing masks in public places. And participants will also be required to stay in Alberta for the first 14 days until their quarantine period elapses. The pilot program will operate initially at the Coutts land border crossing, which has about 95% of land border crossings between Alberta and the U.S., as well as Calgary International Airport, with plans eventually to expand it to Edmonton Airport as well. Though a lot of work lies ahead, we can see a return to normal travel, but pilots like this will lead the way. The results will help shape future provincial and federal policy, and ultimately they'll help to find a new approach for international travel, one that limits the spread of COVID-19 while relying much less on prolonged and very inconvenient quarantine measures. And at the same time, we're also announcing today a new testing option for travelers looking to leave the country. Starting on Monday, Albertans requiring COVID-19 testing for essential international travel will also have a new, more efficient option to get their test results. Albertans will be able to access a new fee-for-service COVID travel testing service offered by DynaLIFE Medical Labs, which of course operates out of Edmonton. For $150, travelers will receive results 72 hours in advance of their arrival time at their destination. This will enable people to get where they need to go safely and minimize the risk of anyone transmitting or acquiring COVID-19. These new tests will support faster turnaround times for travel testing in Alberta. They'll also allow AHS to focus on testing symptomatic Albertans staying in the province, along with those who are involved in outbreaks or the close contacts of them. This is another example of Alberta innovation in our COVID response. Today's announcements are a step forward for an industry that really needs it, and another step forward in Alberta and Canada's recovery from COVID-19. I'll just add that in terms of the truncated, the reduced quarantine period, one of the important steps that we've taken this week is to move completely away from regular testing of asymptomatic individuals, unless, with certain exceptions, of course, like, for example, if they're close contacts of people who have had exposure to people who tested positive. And we've done that in order to speed up our processing times. Right now, about 2 days, sometimes longer, but this will mean effectively that travelers who have come back, who've taken this test at the airport, they get a negative result probably within 48 hours. They just simply have to commit to go back and test again 6 to 7 days later, making the whole process much more convenient. I want to thank our partners in the Government of Canada for their cooperation on this, as well as Calgary Airport. I want to give a shout out to Ed Sims from WestJet, who's been consistently advocating measures like this, as has Air Canada. We've been in constant talks with the federal government about policies such as this. I've been raising the need for at least a pilot of this nature with the federal government and my fellow premiers for months now. And we've been working out the parameters of this particular pilot with the federal government for the past 8 or 10 weeks. I want to thank my chief of staff in particular for really being persistent in nailing this down with the Government of Canada. And really what I've said to the federal and other provincial governments is that we simply must move forward to develop policies that facilitate safe travel as a key part of economic recovery, and that Alberta is prepared to lead the way. So I think this is an important day, hopefully a sign of hope for the many, many people in our travel and tourism industries who are going through a time of great adversity. And with that, I'll hand the mic back to you, Doug.
Thank you, Premier. And the Premier, I think you said a positive. I think you meant negative test on your results when you were speaking there.
Is that what I said?
Yeah, I think you said positive. I think you meant negative.
I meant to say I'm feeling positive. Thank you very much. Yes, it was negative. To be clear, negative.
Perfect. There we go. Awesome. And thank you, Premier. And this is a very important announcement for our local economy here in the province of Alberta as part of our recovery plan. And I can't stress enough how this has really been a collaboration between our team here, the airline industry, the local airports, the federal government, to get us to this point. Because so many people have mentioned to us the fact that the tourism industry has been so deeply impacted here in our province, as well as the business community and people that need to travel for essential business travel. This is critical to getting us back to more normal life. This is critical for us as we move forward out of this pandemic. Make sure that we have the ability to travel between jurisdictions. It's based off of the science. It's based off of safe practices in working with our health professionals to get this done. So it's just critical for us here in the province of Alberta to be at the forefront of this, to lead the charge ahead, based off of the evidence, based off of the facts, based off of the advice from health professionals to get this done. And so many of us have known we'd like to be able to do certain travel, but the impediment of having 14 days upon return simply made it not feasible. So bringing this down to most likely around 24 to 48 hour turnaround time for people is critical. We have to have that for people so they have this certainty when they're traveling, when they come back home, that it's going to be a very short turnaround time that they can get back to their normal lives. So we want to thank everybody, thank our partners for doing this here with us today. This is just critical for us as we continue on our recovery plan and make sure that we have a viable and thriving airline industry and travel opportunities for Albertans and our tourism industry. So thank you, Premier, for your leadership on this, and I'd like to turn it over to Minister Shandro.
Thank you, Minister Schweitzer. First, following the recommendations of Dr. Hinshaw on using the sanitizer before touching my face mask. So thank you very much, Minister Schweitzer. As Alberta's Minister of Health, I want to take a moment to highlight the tremendous work that has gone into this pilot program to make it as safe as possible. As Premier mentioned, our top priority is, and it always will be, the protection of public health. Since day one, we have said that our public health measures, including testing and quarantine requirements, must be supported by strong scientific evidence. At the same time, learning to live with COVID-19 doesn't mean we quit exploring new and better ways to protect Albertans and support their health. We can't shy away from testing new approaches in controlled and safe ways. And that's why this pilot is so important. It will help provide critical insight into new and safe alternatives to the 14-day quarantine. We will be taking all necessary health precautions in this pilot. Officials at the ministry as well as at AHS have worked closely with their federal colleagues to make sure that it is as safe as possible, both for travelers and for Albertans at large. Officials will be closely monitoring every participant to limit any risk of them creating increased exposure to Albertans. As the Premier noted, in addition to getting tested twice, each person will have to provide daily symptom check-ins, and they will also need to follow other enhanced preventative measures, like wearing face masks in public places, avoiding high-risk settings where vulnerable Albertans may reside, and should symptoms appear at any point, these travelers will be required to isolate and contact Alberta Health Services immediately. We're making sure that no Albertans face increased risk of exposure to COVID-19. And I'm also excited to recognize the new testing for travelers that Premier has announced today. Thank you for coming with us today and joining us. Jason Pincock, the CEO of DynaLIFE, who's going to be the partner here at the airport to provide that testing. So thank you, Jason, for coming here to join us with this announcement. Let me simply state that, and thank you as well to the community partner as well, shoppers who will be providing the test in the community. And let me simply state that Alberta has the most dynamic testing system in Canada, and this new test is another step forward. It ensures that travelers can continue to get the tests they need while enabling public labs to focus on the tests that matter most. Those for people who have symptoms and who are part of an outbreak or a close contact of a confirmed case. Alberta has fared extremely well during this pandemic. Together with our partners, we have the resources and the expertise in place to protect travelers and to protect Albertans. Our greatest strength as a province is, and always will be, each other. So thank you very much, and I will now ask Bob Sartor, the CEO of the Airport Authority, to come and say a few words. Bob?
Thank you very much, Minister Shandro. Good morning, everyone, and welcome to YYC Calgary International Airport. Bonjour et bienvenue à tous ici à YYC, l'Aéroport International de Calgary. I'd like to thank and acknowledge the fact that Premier Jason Kenney was able to participate even though he is quarantining. Thank you, Premier Kenney. Also, our Minister of Jobs, Economy and Innovation, Doug Schweitzer, of course, Minister of Health, Tyler Shandro, that we just heard from, and of course our hub carrier president and CEO of WestJet, Ed Sims. I'd also like to wish Municipal Affairs Minister Tracy Allard all the best in her recovery and wish her well in her self-isolation. I'd be remiss if I didn't say that in the spirit of friendship and reconciliation, I'd like to acknowledge that we are on the land and traditional territories of the people of Treaty 7 nations and the Métis Nation of Alberta. That's where this airport sits. Ladies and gentlemen, this is an announcement that I've been waiting for and that we have all been waiting for months. This innovative, government-approved, science-based testing trial for international arriving guests is the lifeline airports and airline partners need to instill confidence in air travel once again. We thank both the governments of Alberta and Canada for working with us and selecting our airport to develop this trial. While YYC International Airport is proud to be the first airport in Canada to have this government-approved testing pilot for Canadians, I would dare say we won't be the last. We really hope that this pilot will help in reducing and one day eliminating the 14-day self-isolation requirements that have so crippled our nation. We believe this is a first step to support the safe and healthy recovery of air travel, helping to drive our economy. Our world has changed greatly since March, and the aviation industry has had to be agile and adapt quickly, as have airports. Partnerships and innovation like this are what is needed to help our industry recover from the devastating impacts of COVID-19. Testing is a critical element in restoring trust in Canada's full air transportation system. Airports and airlines are essential in launching recovery for the travel, tourism, and hospitality sectors, and testing will eventually allow this recovery to begin. This testing, along with our #FlyHealthyYYC program, which achieved Airports Council International World Airport Health Accreditation, ensures our guests can be confident from the moment they walk into YYC, go through our security, and board their aircraft that we and our partners have done everything possible to make it a safe and healthy trip. A new era of air travel is upon us, and all of us here at the Calgary Airport Authority look forward to helping pave the way forward. I'm now happy to welcome Ed Sims, President and CEO of WestJet, our hometown airline, to the podium. Ed?
Good morning, everybody. Let me acknowledge the presence of the ministers here today. Thank you for your support. Thank you, Premier, for your opening words. can I also echo Bob's words in acknowledging whose land we stand on today and in wishing a speedy recovery to Minister Allard. It's not an overstatement to say that today's announcement is actually the first piece of good news we have received as an airline since February the 29th, when I sat on a Sunday afternoon watching our bookings get outstripped by cancellations and eventually fall by up to 95%. On behalf of WestJet, on behalf of all my airport team, who I'm delighted to see join us for today's announcement, on behalf of all of our employees, our employee associations, our union partners, and our guests, I'm incredibly pleased and thankful for the hard work that has gone in Edmonton, in Ottawa, to bring this announcement to fruition here at WestJet's home and our hub here in Alberta. Alberta is, of course, where we've built our largest hub based on our 787 Dreamliner fleet and where we recently opened our $60 million maintenance hangar. And as the government of Alberta is incredibly aware, WestJet makes a $7 billion contribution to GDP annually pre-pandemic, and along with our partners in aviation, sustain more than 750,000 direct and indirect jobs across Canada. Those jobs are made more secure because of today's announcement. And while our network has reduced, particularly in recent times, we continue to be here for Canadians, for Albertans, and for Calgarians. We are proactively introducing a new international hub with critically important routes like Palm Springs, like Phoenix, like Los Angeles, Puerto Vallarta, Cancun, and Cabo, direct from Calgary Airport. But this cannot be overstated in terms of its importance of giving peace of mind and assurance to our guests. This pivot is a health and science-based approach that WestJet and indeed all Canadian aviation have been waiting for. And of course, we continue to invest millions of dollars into rigorous health and safety measures, from electrostatic fogging to ionization to ultraviolet cleaning to mandatory contact tracing, and of course to a zero tolerance policy with regards to masks. So we see today as a critical first stage in continuing the closest possible relationship between ourselves, the Government of Canada, the Government of Alberta, and indeed our close partner at Calgary International Airport, to support this step, to implement flawlessly, and to help safely open travel expansion right across the country. Bob, I can't thank you and your team enough for being such extraordinary partners, and we look forward to moving this trial forward and getting more people through our facility. To Premier Kenney in his absence, to Minister Shandro, to Minister Schweitzer, I want to thank you again for supporting WestJet and every single WestJetter at this critical juncture. Your government is making a profound difference, and we are deeply appreciative of having you stand shoulder to shoulder with us through these most difficult of times. And with that, I will open the floor to questions. Thank you.
Just before we take questions, Ed, just a thank you to you. Everybody saw your face mask and your tie. Thank you for your show of support for breast cancer awareness, and through you to your employees for their passion as well in supporting the awareness campaign. Thank you very much. Questions then, Justin?
All right, with that, we will go to the phones. Just a reminder, you available for questions are Premier Jason Kenney, Ministers Tyler Shandro and Doug Schweitzer, as well as Bob Sartor with YYC and Ed Sims with WestJet. And with that, operator, can you please put through the first caller? Please limit your questions to one question.
Our first question comes from Rick Bell of the Calgary Sun. Your line is open.
Good morning, and good morning to Premier Kenney. Yesterday, Premier, you, I understand, were planning to speak in the legislature about COVID-19. Now, obviously, you can't give us the whole speech now, but Could you sort of tell us what your central message is with respect to sort of the state of COVID-19 in Alberta now, particularly in light of the fact that, you know, there are increased case numbers?
Did the line go down? Do you know?
Do we still have the Premier on the line?
Sorry, the typical COVID conference call, I was on mute. I apologize. One of the small annoyances of the past 8 months. Thank you, Rick. Yeah, I was actually scheduled to deliver that address to the legislature right after question period, and I was notified during QP about Minister Allard testing positive, and so had to self-isolate right away. We are obviously concerned about the growing number of active cases in the province and growth in the number of people hospitalized with COVID-19, and that's why we ask Albertans really to take this seriously, because we have been, I think, very successful as a province in maintaining the least stringent public health restrictions while having some of the best results in the Western world. That is to say, if you compare our per capita levels of infections, of hospitalizations, ICU admissions, and COVID-19 related fatalities, they have been, until the last couple of months, lower than the large Canadian provinces, lower than, I think, all of the 50 United States, and lower than all of the European countries with less stringent public health restrictions. So that has spoken well of the ethic of personal and collective responsibility demonstrated by Albertans just using common sense and care to follow the public health guidelines. I would, if I was giving that speech, I would reiterate that our primary goal here is to prevent the healthcare system from being overwhelmed. You may recall that back in the spring, based on our modeling, we had opened up the 2,300 dedicated acute care beds in our hospitals for COVID patients, and about 560 dedicated ICU beds with ventilators. AHS deserves great credit for having turned on a dime that set-aside capacity in case we faced a Milan-style disaster. Thankfully, we had never come remotely close to that. And at the peak in the spring, we had fewer than 100 COVID patients in acute care beds, and I think never more than 20 in ICU. So we have done very well against international metrics and against our own modeling, and in protecting the capacity of our healthcare system. I think it's also important to acknowledge that the virus is here to stay. And unless or until there is widespread immunity, either through natural infection or through the widespread use of a vaccine, we have to cope with it, and we have to carry on with life. That's why in my very first address to the legislature about the pandemic, I said, I invoked the British slogan that during the Blitz, keep calm and carry on. We cannot shut down our lives, and our twin goal here is protecting both lives and livelihoods. But that is especially important in Alberta with the depth of the energy price collapse and its economic impact. And that's one of the reasons that we've been intentional about taking a less stringent approach to mandatory public health restrictions, including in the last month or so. Now, as I've said before, Rick, we cannot completely exclude the possibility of targeted, limited restrictions in the future if we determine that a case growth could begin to jeopardize the healthcare system. But if we do that, it will be based not on a hunch, not on political pressure, but on data. I'll give you one specific example. We see other jurisdictions across Canada and around the world once again hammering the hospitality sector. We have, and I would have spoken to this yesterday, we have the third largest employer industry in the province is the restaurant industry. And thousands of our restaurants are, well, many have already closed, and thousands of others are barely hanging on and could not survive another lockdown. Could not survive shutting down in restaurant service, for example. So the leader of the opposition the other day suggested we should start imposing restrictions on the hospitality sector. But that wasn't based on data. As far as I can tell, that was based on politics. Fewer than 3% of the traceable COVID cases in Alberta have been because of spread in restaurants and pubs. So what I'm suggesting, Rick, is that when it comes to any potential future restrictions, they will be limited, discrete, targeted, and focused and based on data, not indiscriminate policies that shut down and impair entire segments of our economy. So I guess that summarizes part of what I would have said yesterday.
Thank you. Operator, can you please put through the next caller?
Our next question comes from Bill Fortier of CTV. Your line is open.
Good morning, Premier. Good to hear that was a mistake on the test.
Yeah.
Glad to hear it. Just curious, and maybe this is to you, maybe this is to Minister Shandro. You mentioned an expansion to Edmonton International in the future. When would you like to see that happen? Is that something a month away, or is that further than that?
We're hoping early in the new year. Edmonton's very eager to host this pilot program. We need to get it up and running in Calgary first and at Coutts because please remember that all of this is based on the approval and cooperation of the Government of Canada. And I think understandably they wanted to start it on a limited basis. So we're hoping for, Tyler, you can correct me if I'm wrong, but we're hoping that by February we can get this up and running at Edmonton Airport, assuming that the pilot goes well out of YYC and Coutts. Tyler, do you want to comment on that?
Have anything else to add to that? I think that's exactly correct, and it's going to take this project getting up on its feet first, and as well with us and AHS working with our federal partners and the Airport Authority in Edmonton, and so we're looking forward to being able to expand it as soon as we can.
Thank you. Operator, can you please put through the next caller?
Our next question comes from Kelly Kreiderman of Globe and Mail. Your line is open.
Hi, Premier. I hope you're doing well. I was just wondering if your discussion of having voluntary restrictions versus mandatory restrictions in the COVID era and the recognition that this is with us for the medium term, do you think that policy that you've developed, that the push to keep things voluntary rather than mandatory, is that something specific to Alberta political culture that is different from other provinces? And would you ever cancel Halloween and trick-or-treating?
So on the second question, no, we are not canceling Halloween, and Dr. Hinshaw's offered safe guidelines for trick-or-treating. I know that some people out there will say, oh, this isn't necessary and that there's a kind of a risk. Listen, here's our point. Yes, there is risk. We cannot eliminate the risk. We have to manage the risk. We have to manage the risk using care and common sense. And I don't want the children of 2020 to go through an experience of radical change in their lives. That's why we reopened the schools, partly so kids could socialize with their peers again for their own development, their own emotional health, and mental health. So as much as possible, within safe guidelines, we've got to try to let people live normal lives, and that's partly what Halloween is about for kids. And in terms of our less restrictive approach, look, we're doing this not based on politics, but on the public health advice that we get, on the reality of the threat of the disease to our healthcare system. And here's the reality: we've done well, not perfectly, but we've done well with a less restrictive approach. And I believe we can continue to protect the healthcare system without widespread disruptions and lockdowns that have massive, broader consequences. I guess part of what we are doing here is looking at the broader health context. Yes, physiological health, but also mental and emotional, social and economic health. These things are all linked. And so we're taking that broader view. It is true, I think in Alberta, I think polling has demonstrated this, that there is less support for lockdown-style policies in this province. And I think the intuition of Albertans who are skeptical about lockdowns is pretty correct. And finally, I think it's also important, I would have said this in my address yesterday to the legislature, to acknowledge that while COVID-19 still poses a very real risk and must be taken very seriously, that thankfully the mortality rate, the case fatality rate, the ratio of hospitalizations that end up in COVID fatalities has come down quite significantly. In fact, our case fatality rate in Alberta has come down by 70% since the spring. Now, that's partly a reflection of the higher level of testing and therefore of cases, but it's also a reflection of what we've seen globally, which is that the virus appears to be less lethal now than it was in the spring. Part of that is likely due to developing better treatments, more effective treatments, in some cases earlier diagnosis, in some cases a younger cohort of the population that are getting infected. There are papers out there suggesting that mutations in the virus may as well have led to a lower level of lethality. But whatever the reasons are, we are seeing a smaller percentage of our positive cases ending up in hospital and ICU and as COVID-related fatalities. So we have to continue to closely track that data to inform our smart public health response.
Thank you, Premier. And I would also supplement your answer just by reinforcing the point that the voluntary measures were the recommendation of our public health officials. It was not an idea that's dreamed up by a politician. And I think, especially when we need Albertans to be following the guidance of our public health officials and Dr. Hinshaw and her recommendations, for us to be successful in Alberta, I think that's going to require people giving deference to that guidance, deference to those recommendations. And I caution people who want to feed into the idea that her independence and credibility should be questioned. So this is the recommendations of our public health officials.
Thank you.
And I'll just add one particular point on that is that, in many other jurisdictions, the very first restrictive policies they're reintroducing are to indiscriminately shut down elements of the hospitality sector that is already struggling for survival, even though here and in other jurisdictions we see very, very few traceable cases to the hospitality sector. What we're most concerned about in terms of exposure in Alberta comes from people who have either tested positive or who are symptomatic, failing to self-isolate and going out and circulating in the general population. And so that's why that's why it's so hugely important that people follow that advice, that if they're not feeling well, if they have symptoms, or certainly if they've tested positive, it's just critically important that they self-isolate. And, that is the single greatest thing that people could do to limit spread in Alberta right now.
Thank you. Operator, can you please put through the next caller?
Our next question comes from Lisa Johnson of the Edmonton Journal. Your line is open.
Hi, good morning. Thanks for taking my question. I'm wondering if you can speak a little bit to the situation of when staff were informed that the Minister of Municipal Affairs had tested positive, and what the government is doing to protect staff. Are there any plans for new safety protocols at the legislature?
Well, I don't know if Minister Shandro has more detailed information than I do, but I was informed about this just having left question period about 3:05 in the afternoon yesterday. So I think staff were informed. When I say staff, officials in the government were informed by Minister Allard just minutes before that, and so mid-afternoon. And my understanding is that, my office worked to determine which other MLAs and ministers and senior officials Minister Allard had been in close contact with. And of course, Alberta Health Services also began their own contact tracing with respect to close contacts of Minister Allard's. I suspect that she herself has also reached out to people with whom she had been in close contact. My understanding is that Minister Allard began exhibiting symptoms on Friday of last week. She attended a press conference with me on Thursday morning of last week. She seemed in good health, and she apparently was not exhibiting any symptoms. So she did the right thing. The moment that she exhibited symptoms on Friday, she self-isolated. She got tested, and that test result came back yesterday afternoon. So I think all of the appropriate protocols have been followed, and any staff, whether in the legislature or in her department, would have been notified as quickly as possible if they'd been in close contact with the minister.
Thank you. Operator, can you please...
In terms of the legislature generally, I'm sorry, just following up, the legislature was not in session last week, and so Minister Allard was not close to was not a close contact of any legislature employees last week. The legislature does have protocols in place. We're operating on a reduced quorum basis with people who are social distancing in the chamber and trying to follow all of the public health guidelines as carefully as possible.
Thank you. Operator, can you please put through the next caller?
The next question comes from Graham Thompson of iPolitics. Your line is open.
Thank you for taking the question. Premier, I hope you're doing well at home. I was just wondering, first of all, would you think of following the guidelines put out today by your own travel pilot program to maybe get you out of isolation quicker? That's sort of a sidebar question. My other question was about the controversy over the recommended changes to the kindergarten to grade 4 curriculum, which includes apparently adding Bible verses to the curriculum, teaching children that most non-white people in Alberta are Christian. This is being called regressive and racist and out of step by some experts, and maybe making us a laughing stock in North America. What do you say to that?
The first question, I would love to be able to get out of self-isolation more quickly, but I'm going to follow our protocol, obviously, which is to self-isolate for 14 days following exposure to a close contact who was COVID positive. And the reason for that is even if you get a negative test, the virus can develop subsequent to that, and there always is the possibility of false negatives. But perhaps we will. Perhaps our chief medical officer will look at modifying that at some point in the future. But it is our rule for the time being. And I should also point out that there are multiple screens for travelers. I mean, in many jurisdictions, you can't board a flight unless you've had a recent negative test, or certainly you're screened for symptoms, screened for temperature at departure, upon arrival. In this protocol, there will be a daily report in on your health status and a high degree of monitoring. So there's multiple steps to minimize risk with respect to returning international travelers that participate in the program. On the second question, what you're alluding to are very initial inputs from consultants who are PhD academics, published academics who taught at leading Canadian universities, providing initial potential input into curriculum development. We are a long way from making decisions. It's a multi-step process. We committed to Albertans to develop a renewed curriculum that focuses on critical knowledge and skills, and that I know that there are some people who style themselves as curriculum experts who don't agree and who would prefer the approach of the previous government, which I'll remind you in the draft social studies K-12 curriculum framework document made zero reference to Canadian history per se, zero reference to Confederation, to parliamentary development of parliamentary democracy, to our core institutions, to the rule of law, to Canadian military history, to central facts that help to develop basic civic and cultural literacy. So we want a curriculum that provides key points of knowledge to develop civic and cultural literacy and social studies, and so that's our goal. And obviously, that curriculum will include substantial content with respect to Indigenous history, including the tragic reality of Indian residential schools in Canada's past. So I can assure you that the final curriculum that we develop and approve will be a balanced, thoughtful, and inclusive curriculum that in social studies informs civic and cultural literacy, and that it provides, I think the vast majority of people will see as providing young Albertans with the knowledge that they need to make their own judgments, particularly on historical matters, for example.
Thank you. We have time for one more. Operator, can you please put through the final caller?
Our next question will be Andrew Lawton, True North. Your line is open.
Good morning, Premier. As you know, there are varying degrees of recommendations from public health agencies across the country and in different provinces. Ontario, for example, is telling people to stay home as much as possible still. With your commitment to helping the Alberta travel and tourism industry, would you like Canadians from other parts of the country to visit Alberta right now as tourists?
Well, as Alberta is an open and welcoming province, the guideline is to limit travel for essential reasons, but we have certainly welcomed tourists over the past several months. And we just ask if they come to Alberta that they follow the safety protocols, that we have the public health advice that we have in place. And I think this is an important point. We need to get not just international travel moving again, but safe domestic travel. We have resisted the pressure from some to establish the kind of Atlantic Canadian travel bubble, which has completely devastated the travel industry in that region. Tyler, do you want to say anything more about that?
No, I think you got it. You hit the nail on the head, quite frankly, Premier.
All right.
Concludes our questions for today.
All right. Thanks very much.